My name is Aisha Kazi. I am a third-year medical student at Arkansas College of Osteopathic Medicine, and I'm originally from Atlanta, Georgia, though. So today I'll be presenting on a literature review that I've been working on that discusses the effect of 17-beta estradiol, which is the most potent form of estrogen, on cognition in women. So what initially sparked my interest on this topic was the gender differences that we observe in neurodegenerative diseases. For example, Alzheimer's disease. Women are actually disproportionately affected by Alzheimer's disease, with actually an earlier onset as well as a greater severity. So my literature review actually compiled numerous different studies, but I went ahead and selected 5 particular studies that can be divided into 3 different categories for this presentation. The first category is the presence of estrogen in the brain. The second category demonstrates the neuroprotective function of estradiol and its ability to enhance memory. And the third category shows the role of estradiol in Alzheimer's pathology. So we'll go on to the experimental studies because there's quite a few. So in the first experimental study, they utilized male and female Sprague Dawley rats, and they removed the adrenal glands in the gonads of the rats. And they noticed that there was a significant increase in estradiol synthesis in the cortex of female rats. So this concluded that essentially estradiol synthesis does occur in the brain independently of the adrenal glands in the ovaries, demonstrating that it does have an importance within the brain and its effect on cognition. So the second study utilized normal adult and aging female rat models. What they did was they analyzed 2 different estrogen receptors, ER alpha and ER beta, in 2 specific regions of the hippocampus, CA1 and CA3. And they wanted to observe the quantity of the estrogen receptor in a normal female rat and an aging adult female rat. And they noticed that there was a significant decrease in both ER alpha and ER beta in the aging female adult rat compared to the normal healthy adult rat, with a 78% decrease of ER alpha and an 88% decrease of ER beta. And then we went on to study the second category, which is neuroprotective functions and the ability of estradiol to enhance memory. So the third study was analyzed on female rat models in which they administered exogenous estradiol as well as ER beta agonist diarylpropanitrile in the intraperirhinal cortex of the female rats in which the ovaries were removed. And to analyze memory, they use a novel preference test. So essentially, they have 2 phases. They have a familiarization phase and a testing phase. In the familiarization phase, they try to make the rat familiar with the sample object. And then in the test phase, they change the location of that object. So if they spend an increased time on the novel object, which is the object that's placed in a new location, if they spend more time with it, it essentially indicates that there's intact memory recall due to familiarity with the sample object in its original location. So they noticed that with the exogenous estradiol, it enhanced the novelty preference following a 4-hour delay. And then they noticed that when they gave the exogenous ER beta agonist, it enhanced novelty preference following delays of 4 and 72 hours. So essentially, this demonstrated that both estradiol and ER beta receptor agonist treatment can both enhance memory recall due to the ability to recall the familiar object in its original location. The fourth experimental study analyze the neuroprotective function of estradiol. So they used female mice in which the ovaries were removed, and they were treated with 0.1 milliliter of a sesame oil, which is the placebo, and a 17-beta estradiol treatment. And they noticed that the estradiol increased the number of mushroom dendritic spines. So dendritic spines can have very different morphology. They can be stubby, They can be mushroom shaped, they can be thin. The advantage of mushroom shaped dendritic spines is that it increases the postsynaptic region for AMPA and NMDA excitatory neurotransmitters. So if you take a look in this figure in study 4, B and C are showing the dendritic spines with the sesame oil, and D and E are showing the dendritic spines when estrogen was administered. And you can notice that they have much larger heads and they're mushroom shaped, increasing that postsynaptic region. They also noticed that there was an increase in postsynaptic proteins such as spinophyllin, PSD95, and syntaxin, as demonstrated right here in this figure. I'm not sure if you can see my mouse. So essentially, these results demonstrated that estradiol does potentially have a neuroprotective function, and these dendritic spines, as well as these postsynaptic proteins, have been associated with memory enhancement. The last experimental study analyzed glutamate uptake in cultured human astrocytes in Alzheimer's patients. So they essentially compared the glutamate uptake in cultured human astrocytes in non-demented and Alzheimer's disease patients. And in figure B, they demonstrated that there was an increased glutamate uptake upon 10 and 100 nanomoles of 17-beta estradiol, demonstrating that estradiol can potentially improve glutamate uptake in Alzheimer's patients, which has a strong association with the ability to enhance memory. So all of these results, they demonstrate a strong significance of estradiol and its effect on cognition. And recently, the Alzheimer's Association just received a SAGA grant, which stands for Sex and Gender in Alzheimer's, which is aimed to understand the gaps in the role of biological sex and the female's increased vulnerability to Alzheimer's. So I'm very hopeful for the future of this research. Thank you. And does anybody have any questions?
I have a quick question. Absolutely lovely topic, by the way. I was enthralled. I wanted to ask, were there any weaknesses in the study that you would say?
So majority of the studies that I collected in the literature review which was almost 35 studies, they were all conducted on rat models, specifically the Sprague Dolly rats. So it would be nice to be able to use different subject models, whether it would be animal models or human astrocytes, but there's been very few studies done on cultured live cells. So that would be a very good next step so that we can translate the research in this field into something more clinical.
Wonderful. I completely agree.
Thank you.